although it provided a challenge, but we believe that it also provided Nigeria with an opportunity to re-engineer our health infrastructure. And his movement, I was a co-conspirator with the president to have him move to science, technology, and innovation was informed by the fact that we believe that the future of the practice of health was going to be informed substantially by our investment in the area of science, technology, and innovation. Because that is what is going to drive our health infrastructure going forward. We cannot remain at the rudimentary level that we are and expect any meaningful progress and development in our health infrastructure. So I plead with the public health community to pardon us for having moved him, because when we moved him, there was a little bit of ground shaking in the Ministry of Health. I believe strongly that our country is a great country. Either in or out of office, we have the collective responsibility to ensure that we all work together and collectively to get our country to the level that will meet the aspirations and the thoughts of our founding fathers. Right now, we are getting there, but it will require every one of us setting out and decisively within our hearts convinced of the fact that we need to make this country work.
It was a tough battle. You know, all over the world, tobacco manufacturers or tobacco industry, they have a very, very powerful lobby group. So there was an attempt to scuttle that bill. So it was a strong battle, but by the grace of God, we succeeded in pushing it through, and it was passed by the Senate, and we had concurrence from the House of Representatives.
Essentially, the message we are passing today is that the CSO movement, particularly the public health community, were not adversarial to the government. We essentially want to partner and work hand in hand with people in government, and to say we are willing to work. As you can see here this evening, there are senators, ex-governors, ex-ministers, ex-SSG here, that we are willing to work as technical partners of agencies of government, of parliamentarians, to ensure that appropriate laws for the protection of our people are enacted. And that when people like that work with us, we will be able to say, silver and gold we don't have, but a night like this, we can then express our sincere thanks to them.
And since we started the tobacco control journey in Nigeria, Senator Mamura's name has always come up as one of the champions, actually, as one of the champions for tobacco control. He started the journey when he was in the Senate, and was able to, bring a lot of passion, a lot of commitment to the issue of tobacco control, getting Nigeria to have a tobacco control bill and also pass the tobacco control bill. Of course, he started the journey, he didn't quite finish it, but some of us came on board working with some of his colleagues to complete the journey. And because of his passion and commitment for public health and tobacco control, I would say that he's made a really big contribution to where we are right now.
We work with civil society organizations, local organizations who are advocating for public health policies to reduce deaths and diseases. And in Nigeria, we've partnered with a few organizations, such as the Corporate Accountability for Public Participation Africa, who are the organizers of today's event. And today, Nigeria is recognized as the first country in West Africa to pass that particular regulation, and the second country in Africa as a whole. It's because of his leadership his contribution to the entire process. And so we're here to celebrate him and thank him because he represents a number of things. He represents health, and so we're here to celebrate public health.